社区疫情防控组疫情排查组组长陶存新先生，武汉市江岸区塔子湖街党工委书记王孝启先生，武汉市精神卫生中心副院长刘连忠先生。
Xiao Qi, Party Secretary of Tazihu Street of Jiang'an District of Wuhan, and Mr. Liu Lianzhong, Vice President of Wuhan Mental Health Center, and Mr. Li Yang, Deputy Director of Hubei CDC. First, I would like to give the floor to Mr. Li Yang for the updated numbers. As of midnight of April 6, the total number of confirmed COVID-19 cases in Hubei province was 67,803, including 50,008 in Wuhan, taking up 74% of the total infections in Hubei. 17,795 cases were reported in the rest city in Hubei, accounting for 26% of the total amount. As of April 6, 2020, the new case of confirmed infections in Hubei was 0. No imported cases were reported in Hubei, while the cities outside of Wuhan have maintained no new cases reported for 33 consecutive days. As of April 6, there still remained 518 patients in hospital, including 111 in severe condition and 73 in critical condition. As of April 6, 2020, the total fatal cases stood at 3,212. And yesterday, 0 new deaths was reported. As of yesterday, the cumulative discharge patients reached 64,073. Yesterday, the newly discharged number was 59, all in Wuhan. As of midnight of April 6, the newly increased asymptomatic cases were 18, none of which developed to the confirmed case yesterday. 33 asymptomatic patients have been removed from quarantine and 690 are still under medical observation. Thank you. I will give the floor to Mr. Hu Shuguang regarding the establishment of a long-term mechanism at the community level regarding the epidemic prevention and control. Under the strong leadership of the CPC Central Committee, great support given by the provinces across China, as well as the brave fight made by people in Wuhan and Hubei, we have seen a promising progress in Wuhan and the good achievements have been made. On March 18, that's the first day with no new reported of infections, except 2 days with 1 new case reported. The rest of the days till now, it's over 20 days, we have no new cases reported in Hubei. With the authorities' evaluation on the pandemic development, so far the epidemic spreading in Wuhan is basically contained and is also under control, which also laid a favorable foundation to promote the economic and social development. As approved by the central government, 12 a.m. this evening, or we talk about on April 8th, Wuhan will reopen after 76 days of lockdown. This is a big news that calls everyone's attention home and abroad, and also waited for so long for people in Wuhan. But that said, we should also level-headed. We should not relax mentally and slacken off our containment efforts. We should always stay as we are in day one and secure the hard-won results and achievements. At the same time, we would also let everyone to understand that no new cases is by no means zero risk. lift the restriction. Lifting the restriction doesn't mean lifting the prevention and control measures. And opening the doors to the outside doesn't mean that we're actually free from everything. Right now, Wuhan is still in a critical stage amid the pandemic. We should always touch great importance and make the disease prevention and control as the top priority. Under the requirement of coordinating the pandemic prevention and control with economic and social development, we should arrange our work, especially at a community level. In order to do so, we will earnestly implement the instructions made by General Secretary Xi Jinping in keeping our energy and morale towards disease. The Wuhan Epidemic Prevention and Control Office has also introduced a long-term mechanism in fighting against the outbreak and also the work at the community level. In the document, we emphasize that we should have a strong leadership and also can do a good job in a well-detailed manner and also can treat patients effectively. This system should be a long-term one. And for the work on the community level, it includes the following. First, we should improve and adjust the flexible room of measures that can take at the community level. Starting from April 8th, in order to conduct the prevention and control work at the community level, it is allowed to remove or adjust or optimize the physical containment efforts in order to promote the resumption of work and production. And second, the stringent in and out community should also carried on. We should check everyone's temperature and everyone should wear their mask. And with the allowance or the certificate for that communities, but these policies actually in place should not be added on other additional ones. And the unnecessary going out also discouraged in order to prevent from the cross-infection. And third, we also do a good job in screening infections, especially on a key group of people. For the asymptomatic patients, people from outside of Hubei and also overseas, as well as people turning negative again, we would like to conduct the work in order to find their symptoms as early as possible and also give them the treatment if applicable. And for the key group is for the people in disability or the elderly living by themselves, we should also keep a close eye on their symptoms or their basic living conditions. And fourth, we will continue our work on patriotic hygiene campaign. By practicing this campaign, we would like to make the public aware about the hygiene and also protect themselves and also the capability of doing so. At the same time, we will also release the pandemic prevention and control information in a swift manner, make sure that the people will not relax mentally or bluntly beating up. And we will continue to apply the stringent measures on the public areas and also issue the technical guidance as soon as possible. And fifth, the cadres working at the community level as well as the employees from the governmental authorities, they should stick to their position and allowed to get back to their original work with the development of the spreading. And for the doorkeepers, the community also allowed to make shifts. And the community with the property authorities is also to let the property authority to take a leading role. And for the communities without a property authority, it's also to hire volunteers as well as a person dedicated in such job in order to establish a long-term effective measures. And 6, in order to promote economic and social development amid the pandemic, and the cooperation of the emergency and long-term mechanism, we would like to see a system established in the municipal, community, and village level, emphasize the leadership role, and also give the full play to the community as the sound foundation of the fight against COVID-19. We should also let everyone know clearly about their role and the responsibilities and make sure all the policies and the measures can implement to its letter. We should also do a good job on the community level that's conducive to prevent the imported cases and its further spreading, and also protective people's fundamental interests as well as their safety and health. We believe that with the understanding of our people and with concerted efforts, we will for sure win the final victory in Wuhan. Thank you. Now the floor is open. Please identify your media affiliation before asking questions. Renmin Night. So why you still need to establish a long-term mechanism after April 8th as Wuhan is going to lift the restrictions? As I just introduced in my opening remark, with arduous efforts, so far we have seen a phased achievement in containing the virus in Wuhan. Right now, we're coming into the stage in advancing economic and social development while doing a good job in disease prevention and control. But on the other side, impacted by the pandemic at the international community and the changes brought by free of restrictions, we will see some uncertainties which make our job more challenging and harder to prevent disease. So after April 8th, we will follow a major guidance of taking our measures in a scientific and precise manner, make sure that our work can be carried out in a smooth and guaranteed way. And one of the top priority is the work at the community level. I would like to give you some reasons. First, Wuhan will very soon reopen to the outside world. So looking at the mode and content of our disease prevention and control will be changed. Before, all of the activities actually were limited, and we conducted a static management. We were in a hard time. However, we basically knew from A to Z of the activities and people. But from tomorrow, with a large flow of a population and the resumption of work production, market, and also back to school, So the whole mode actually will also change from static management to dynamic management, which means there will be more uncertainties and difficulties in our work. Before, our key focus was to prevent the disease from spreading in and outside of Wuhan and Hubei. And you see, we have made a great contribution, and we also locked down the communities in Wuhan. Right now, our main focus shifts to the preventing imported cases and is further spreading inside Wuhan. So the overall situation and the pandemic development actually is all changed. We also facing a harder job to prevent the imported cases. Right now, the confirmed cases is exceeded 1.3 million globally. Wuhan, with its advantage in transportation, also is more known as a quite busy city in China. And since Wuhan is going to restart its normal life and business, we will see more activities will conduct it home and abroad, so which means we will see more imported cases. And on top of that, asymptomatic patients as well as patients negative or positive to virus again are also another factor to us, which is quite hard to evaluate, but that also required our time and energy and focus to conduct a stringent control on these group of people. And third, we also opened up more public areas with the resumption of work production and market. Transportation, tertiary market, shopping malls, and other key public areas will available to the public, which means that will be a large public gathering will be happened. So how to conduct a good job on containing the disease in these public areas, that's also something new to us, because we didn't have that kind of issues before in the lockdown time period. Another issue is that people right now a little bit relaxing their mind. We talk about starting from tomorrow, 76 days of lockdown and 2 months of lockdown of the community will be lifted. So people actually literally stayed at home with no outdoor activities. That is also, we believe, people right now eager to go out. We have seen a 0 new cases reported in several consecutive days, and we also reported a number of asymptomatic cases that may ring the alarm. But compared to the peak of the outbreak, people will be way too optimistic, since we are fine, we're in a good days, and that may cause problems. And before, actually, we sent the encourages and also the employees from governmental office to the community level. But with the resumption of production, work, and market, these group of people will go back to their original position. How to fill in these icons at the community level? That is also another pressure on our shoulder. Therefore, in releasing the documents of establishing a long-term mechanism, we have conducted a wide range of surveys. We talk about that you can withdraw the high count, but you need to find someone to fill in that empty. And we also have a set of measures in place to do so. We talked about before, a key purpose actually was to cut off the transmission channel. Carriers actually are human beings. We talk about in Wuhan, the majority of residents actually stayed in a different community. No matter where they live, no matter they work, they need to go back home, and they have to go back home. So home is the place that we should protect. And every day, our residents come in and out the community, and they also need to do the temperature checking, and also the community gatekeeper also need to ask their health condition. That also help us to find the cases as early as possible. That also require the whole population to help us to do a good job on keeping our home safe. Therefore, I call on everyone to pitch in to make the contribution. Thank you. With China Daily, regarding this long-term mechanism, you talked about the cadres and the employees from governmental office can be withdrawn in an orderly manner. So how you do a good job on community level prevention and control when these group of people go back to their original work? Since the outbreak, cadres and employees of a governmental office went to the community level from day one, playing a key role in disease prevention and control at the community level. And the work should continue by practicing this long-term maximum after these group of people going back to their original position. And we also have made some studies in this regard and mobilize all available resources to fill in the empty roles, make sure that the level of control will not be changed or impacted. 58 communities with property as the management company and also the 3 old communities all in our control, and we also work with the residents union of the community as well as property community to call on each resident to make their contribution. And for the old communities, and we would also to mobilize more volunteers as well as the leader of each building to help us to create that network and facilitate this long-term mechanism. And the key role of the position that used to be taken by the cadre will be carried on by the key people in each community. Make sure that a strong front line of defense will not be impacted. And we also would like to use the cutting-edge technology such as the WeChat group as well as our app to connect people together. And also at each gate of the community as well as the building gates, we would also like to post these policies and announcements. And we also will utilize the loudspeakers to educate the public's awareness on mass prevention and control. With Economic Daily, we have seen a positive change regarding the disease prevention and control in Wuhan. I would like to know more about the role of communities free from infections. Since the outbreak of the pandemic, Wuhan has conducted the lockdown measures of communities. At the very beginning, we lack of experience with learning by doing. Right now, we have summed up a rich experience in this regard. The practice has proved that lockdown communities actually had played a key role in terms of cutting off transmission channels as well as transmission source. 2 weeks after the lockdown, we have introduced a campaign on establishing the community free from infections. The aim actually was to set up the benchmark or good practice. Besides the fixed standards, and we also have 6 additional measures regarding the care to the residents, supply of daily necessities, hygiene in the communities, disinfection works, as well as the mobilization of residents. All these have yielded good results. Right now, we have seen a remarkable progress made in this regard. By April 4th, 98.4% of the communities with the name of free from infections. And the villages, their number is 99.8%, and the number for the streets is 43.8%. We believe, based on our experience, the practice of communities free from infections play a key role in the following. First, it helps us to conduct our disease prevention and control work in an orderly manner. The original aim actually was to cut off the transmission source and also the transmission channel. So this is actually a tough measures, of course, that cause some inconvenience and discomfort to the residents. That also require us to make some education to the public, and they well understood our purpose. We not, for the sake of doing so, by the end of the day, what we wanted actually was to cut off the transmission and also to see the tunnel, see the lights at the end of the tunnel as early as possible. The community free from infections actually also enriched our work. That's not only for the sake to containing the virus, that actually is also to improving the establishment of the communities. And that also help us to improve the efficacy of the work carried out at the communities. By creating more communities, streets, blocks, villages free from infections, that helped us to identify the risk level of different areas in Wuhan, the same as we identify the risk level from low to high in Wuhan province. So that also helped us to understand better about the bigger picture regarding the risk levels, and also we can give the targeted measures and gather the strengths to make differentiated policies and measures to different risk level regions, which also helped us to reach the goal, to realize the goal as early as possible. On top of that, actually also encouraged the people to make their contribution. Since the outbreak, people in Wuhan stayed united and involved in the disease prevention and control. They showed their fighting spirit as well as perseverance. Creating communities free from infections actually is also a benchmark or the incentives or the goals for people to pursue, which also help to mobilize the residents to engage. And we also would like to see that we also establish the mass prevention and control, which laid a sound foundation for us to secure a victory in Wuhan against the virus. Thank you. It's the paper. And now we knew that the screening work actually is so switched from a large-scale screening to targeted screening. So what's the progress made in this regard? Thank you for your question. Right now, we have seen a notable change in Wuhan, showing a positive change. I believe right now we're very close to a final victory. And we also start to send people back to work, to production, to the market. And we also switched ourselves from the track of emergency response to normal order. And we will also very soon see the restriction lifted. After 76 days long of lockdown, everything will restart it. That said, it does not mean that we can relax our efforts in containing the virus. Especially right now, we have seen the asymptomatic patients as well as the discharged patients positive to virus again are posing more challenges to our work. Resumption of work production on the market will also trigger a large flow of a population. On one hand, we should guarantee a sound development of the economy, but on the other hand, we should also contain the virus amid the population flow in order to secure a final victory, a complete victory. This is a new test in face of our containment efforts. As the first, the front line of defense, community should give a priority on preventing the virus to regain its strength again. So in order to achieve this goal, first we should strengthen our efforts in screening at the community level. Nothing should be changed. We should stay as we were in day one, and we should do the screening work in order to identify the 4 group of people that should be in a dynamic manner, and we should also conduct the temperature screening and reporting system as we used to practice. And also for patients discharged from the hospital, we should know exactly the situation with all these people either staying in quarantine or staying at home. For patients positive again, we should identify them as early as possible and contact the designated hospital for further treatment in order to prevent from the cluster infections. Second, we should put a close eye on key targeted people. In order to prevent imported cases further spreading, we should notice the underlying risks. And we talk about the close contacts, medics, and also the people working in the hospitals, and people getting back to Wuhan and Hubei province, and people working in an outdoor venue with a large public gathering. For these group of people, we should conduct an even stringent screening work and also make sure we know their key information and also put them in a file. Make sure we be a good gatekeeper, and also we should conduct a good work in temperature checking, questioning, recording, and third, we should also establish the prevention and control mechanism at the community level, and we also start a new round of training work, and we also will enlarge the number of volunteers and also improve the capability of our people and to conduct this screening work in a long-term manner, make sure we can bring our work in a precise manner. And fourth, we will also conduct the cross-departmental cooperation with the third party by utilizing the advanced technology such as the big data, the possible asymptomatic patients as well as their close contacts. We should target it and identify them within the age grade, and also to do the epidemiological investigation in order to prevent the infections happened at the community level. Hubei Daily. How to help each community to carry out the patriotic hygiene campaign and also make sure everyone temperature checked, information asked, wearing masks. Thank you for your question. From tomorrow, we will see a normal order of economic and social activities restart. That also bring more pressure on the disease prevention and control work at the community level. We talk about all these measures should be well implemented at every community. And so far, we have trained our people, asking them to make working arrangement at each community level, make sure that we have a person in charge to supervise the work carried out by the property companies as well as volunteers. We talk about the peak time. So we will see a more people gathering at a peak time of the transportation. So we should check their temperature, check their IDs, and also whether they wear masks. So basically, all the good practice we carried out before should continue. For off-peak time period, we should implement it according to the document. And for the community levels, we also group them and make sure they will do the checking work to see whether each community is doing all these required behaviors. Regarding the patriotic hygiene campaign, for each community and village, should organize the disinfection work, especially the lift, the underground parking lot, garbage places, and the public areas, and also should guide the residents to throw the used mask to the appointed place in order to prevent the secondary spreading of virus. And that work should also be carried out in each company, so they should also to do a good job in disinfecting their working place. And regarding the garbage, that should also be transported and cleaned every day, and they also need to sterilize the environment. And the same measures should also apply to the village level to minimize the environment to cultivate the virus. Regarding the people in difficulties, such as people in difficulties or the elderly people living by themselves, how you can meet their needs of a daily life. Before, regarding the supply of daily necessity, actually we rely on the online playing as well as the contactless delivery service. So the basic needs of daily necessities have been basically guaranteed. And for the people living in difficulties, and also the people with disabilities and the elderly people, actually will also have the specific service provided. For the 750 people in this group, we also conducted a door-to-door visit. Make sure no household or individuals left behind. Going forward, we will also conduct all these services and also mobilizing the role of building leaders and volunteers, and will also establish the pairing assisting group. Make sure we have people to conduct the buying behavior for these group of people in difficulties. Regarding purchasing prescriptions, before actually we establish a WeChat group. So the people in drugstores and the volunteers in community and also people in the leading position, actually all included in that WeChat group. So a demand from our residents
接着提问。
您好，金楚网记者提问。
can convey it to the people in drugstore in an early
面对
time.
封锁2个多月，我们的患者、
金楚
医护
night.
工作者和广大武汉市民怎样缓解心理压力，保持健康心态？
After 2 months of a lockdown,
好，这个问题请刘彦忠先生来回答。
how our medics as well as residents in Wuhan
首先，
can stay in a healthy mental condition and embrace the new life.
亲信、道听途说的了解，
Regarding
其
patients,
次和亲近的朋友、家人或者寻找心理专业人员进行
should not easily
自己的
buy in the rumors,
第三，
and their family members, friends should also help them, or they can consult with the professionals in order to relieve their pressure. And they also need to stay in a good hygiene and a good daily routines to take care of themselves, and they also need to
人员而言，
learn some
对外界
measures to relax themselves, such as listening to the music or practicing yoga.
与其他的伙伴分享，
And they should not isolate themselves,
保证
and they need to connect with the other people, share their feelings with others,
适度的运动。第三，面对高
and also make sure they
对自己
eat
影响的情绪，
enough nutrients and also do the exercise.
如果感到这些负面的
And that also for the medics. And medics, of course, they have some negative
专业的
the feelings from the work or the pressures, and that's normal. So they should allow this kind of thing happen. And if they still facing big pressure, then they need to consult the professionals. For the public, if they face quite a big pressure, they either can talk to their family members or their friends, and they also need to prepare themselves to get used to the a normal life as before.
随之而来，也出现了一些家庭关系紧张的情
Yangtze
况，
River
如
News.
亲子关系、夫妻关系、婆媳关系等都出现了一定的问题。请问应该如何调试？
We talk about the family actually because of lockdown. They stay so close to each other for 2 months that for sure will produce some the problems
本身
within the family. So we talk about how
可能
to
会把以前隐藏的一些
solve all these families.
当出现这些家庭矛盾的时候，首先不要紧张，因为暴露问
The
题
family ties. Actually, these quite close and long-term
建议家
stay together for 2 months. Actually, for
回忆
sure
这一段时间家庭生活的一些
to
变化，
bring some the underlying
谈谈对
tighten
未来
family
期待
ties above the water.
打算。第二，家庭成
So
员
first of all,
共同的努力
be open and share with each other about the future plan
未来
and their actual feelings. And also the family members
随之
should
不断
work together
陪孩子学习。
and also toward the future to solve the issues together.
家庭成员
And also we talk about that they should have the clear roles and responsibilities, like who should accompany the children for doing the homework, who should go out to buy the daily necessities, and they should also cherish
音乐、锻炼、阅读、
the quality time, the memories,
团结
staying together, and they also can stay
之间的感情。
together to the play the games, listen to the music, watching TVs.
不善于自我表达，这时候我们更要
And
耐
third,
心地了解
should
真
also
实的内心的需求，
listen
耐心的去
to your family member. Some of the family member are not really
解决心理问题。
that open or
最重要的
not
是
really eager to talk. So you need to encourage them to say things out.
才能维护家庭成员的心理健康。谢谢。
So all in all, face-to-face communication,
各位发布人，
stay in
再
contact.
次感谢
That's actually conducive to a healthy and sound family relations. Thank you all the guests and also our